Welcome to Pharmacy Pearls, drug therapy that works. Today's edition will focus on a simple change, one that you can make today for free, that will help your blood pressure medications work more effectively. In order to illustrate, let's meet Doug, a 55-year-old man with high blood pressure. Doug has struggled to get his blood pressure under control, despite using 3 different blood pressure-lowering medications, each of which he takes in the morning. Is there anything that he can do to better control his blood pressure, and more importantly, lower his risk of developing heart disease? As it turns out, there is. In 2010, a well-done, randomized controlled trial called the Peck Study demonstrated that taking at least one blood pressure-lowering medication at night leads to better control and improved patient outcomes. Despite this, most patients, like Doug, take all of their blood pressure medications in the morning. Let's take a closer look at the results of the Peck Study. It included patients who had a diagnosis of either untreated high blood pressure or uncontrolled high blood pressure despite treatment with 3 or more medications. Patients were randomly assigned to 2 groups, those who took all of their blood pressure medications in the morning and those who took at least one blood pressure medication at bedtime. Over 2,000 patients were followed by researchers for an average of 5.6 years in order to see who experienced heart disease-related events and who died. At the beginning of the study, the 2 treatment groups were very similar with respect to health status and blood pressure. The average age was 55, and 48% of participants were men. Throughout the study, patients in the bedtime dosing group had better blood pressure control, but what's more important, they also had better health outcomes. For example, in the morning dosing group, 25 people out of 1,000 died. By contrast, in the bedtime dosing group, 11 or 14 fewer people out of 1,000 died. This means that to prevent one death, 71 people would have to adhere to their bedtime dosing regimen for 5.6 years. In addition, in the morning dosing group, 67 people out of 1,000 had a heart disease-related event, such as a heart attack or stroke. In the bedtime dosing group, 28 or 39 fewer people out of 1,000 had a heart disease-related event. In order to prevent one heart disease-related event, 26 people would have to adhere to the bedtime dosing regimen for 5.6 years. The impact of this simple change is staggering when you consider that about 7.5 million Canadians, or an estimated 40% of adults over the age of 25, have high blood pressure. But why does bedtime dosing improve outcomes? Well, most people experience an increase in blood pressure during the day, with peaks in the morning and evening, followed by a decline in blood pressure at night. Interestingly, this nighttime decline in blood pressure is less pronounced in some people, and this phenomenon, called non-dipping, increases their risk of heart disease. Baseball legend Yogi Berra once said, "You don't have to swing hard to hit a home run. If you've got the timing, it'll go." Sometimes successful drug therapy, like the long ball, is all about the timing.